Begin by checking the expiry date on the outer package. Do not use the product if the date has passed. Then equilibrate the test kit to room temperature before use. Thoroughly sanitize your workbench and your hands. Unpack the test kit components onto the workbench and carefully read the enclosed instructions for use. Then pierce the foil seal of the tube with diluent using the long pointed end of the dropper. The best time to collect your sputum sample is first thing in the morning before rinsing your mouth or brushing your teeth. Inhale deeply and exhale forcefully through your mouth and repeat 3 times. Cough deep from within your chest to produce sputum, then spit your sputum into the sputum dish. Sputum originates from deep inside your lungs and should be slightly yellow or green in color. Remove the sterile swab from the pill pack, being careful to avoid touching the sponge tip with your hands or contacting it with any foreign surface. Fully cover the swab sponge tip with sputum by placing it in the sputum dish and applying a mixing motion. Fully immerse the swab sponge tip into the diluent. Then squeeze the tube against the swab tip and rotate the swab stick in a twisting motion for 30 seconds to ensure all the sample is mixed into the diluent. Remove the swab while continuing to squeeze the sides of the tube so as to extract all the liquid from the sponge tip. Then safely dispose of the swab. Hold the dropper by the protective cap and insert the long pointed end into the tube until it is securely fitted. Gently mix the sample again by rotating the tube for 5 seconds in a stirring motion. Then remove the protective cap from the dropper. Remove the test cassette from its foil pack if you have not previously done so. Invert the tube and squeeze 3 drops into the small sample well at the bottom end of the test cassette. You may continue the test even if you accidentally added 4 drops. Start the stopwatch and read and test result after 15 minutes and up to 30 minutes, beyond which the test results are no longer considered valid. If the C line displays a visible color band, even if faint, and T line is blank, then the test result is negative and you are unlikely to have COVID-19. If both the C line and T line display visible color bands, even if faint, then the test result is positive and you most likely are infected with COVID-19. If the C line is blank, then the test result is considered invalid. On completion, dispose all materials in a plastic bag and sanitize your hands thoroughly.